welcome back to Prime Morning. It's time for a great conversation. I urge you to please get interactive with us on all our social media platforms. If you just joined, this is Prime Morning, and it's time for us to have a very great conversation. Like I said earlier, please get interactive with us on all our social media platforms. Go on Facebook. It is Joy Prime. Don't add the TV. Our WhatsApp line also is 055-157-5757. Now, today we are talking prematurity or preterm babies. What is it you know about preterm babies? And so I have an expert in the house. I'm ecstatic about her because it's funny. It's a very small world. You know, she's my mate from Wesley Girls, and little did we know that one day I will end up interviewing her on a topic like this, and I'm ecstatic about this one. But before I introduce my guest to you, now approximately worldwide, about 15 million babies are recorded to be preterm, and out of that, or accounting for 1 out of 10 babies worldwide. The 17th of November is World Prematurity Day, and it's celebrated yearly. Now, this is to raise awareness for concerns that is associated with preterm babies and their families as well. So today I have a doctor with me, and she's the person I was talking about earlier, Dr. Belinda Odai, Medical Officer, Neonatal Intensive Care Unit, Tema General Hospital. Hi, Belinda.
Hello, Ajwa.
See. Yo, why do you have to call me Ajwa? It's fine. But I'm excited seeing you this morning, and I'm happy about the conversation that we're about to have. So seated to Belinda's right, I have Ruth Soa, who is a mother who had a preterm baby. So yes, kindly pardon us if you hear the baby making noises, crying here and there. So we are going to be speaking to Ruth to share her experience being a mother of a preterm baby. And then I have Mavis Nyamadi, who is also a nurse. Mavis, where's your doll? Oh, you gave it out. Yeah. Okay, so Mavis was holding a doll and she's going to do a demonstration. And so please make sure that you stick and stay with us right here on Prime Morning. This is very, very imperative. I want you. This conversation is great for all of us. So please make sure that you stick and stay, and you can start sending in your questions in relation to preterm babies. Okay? So, Belinda, let's get started with what is prematurity. Let's get started with that.
I'd like to use this platform to say a good morning to all our cherished viewers. So if we are here clapping people, it's not just a coincidence.
Yeah.
We are here celebrating prematurity, and then someone may be wondering what exactly is prematurity. So any baby born less than 37 weeks is considered premature. So
any baby born less than 37 weeks.
Completed weeks is considered premature. Okay. So we have, the types, we distinguish them. So we have the extremely preterms, that's from 28 to 32, and then we have from 32 weeks onwards.
Okay.
Yeah, so any baby born less than 37 weeks is complete.
So ordinarily, what is the number of weeks that a woman should carry or can carry a baby?
Ideally, we want 40 weeks.
40
anything 37 completed weeks and above is fine. But we want between 37 completed weeks and 40 weeks.
Okay.
Not more than that.
Okay. Now let's come to how common prematurity is here in Ghana.
It's quite common in Ghana.
How I wish our little boy would. Okay, viewers, so we are talking prematurity today. Tomorrow, like I said earlier, November 17th is World Prematurity Day. And so in case you have only heard about prematurity, but you don't really know what it is, you don't really know some of the concerns that most especially the mothers of these preterm babies go through, some of the things that they do, how they have to take care exactly, or the proper way of taking care of preterm babies. This conversation is for you, so please make sure that you stick and stay with us right here. Our baby is okay now, I think, because he's gone back to his mom. So Belinda, now let's talk about how common prematurity is.
prematurity is quite common. You have about 1 in 10 babies being premature.
1 in 10 babies,
1 in 10
yes.
babies being premature.
Yeah.
But in Ghana, our rate is as high as 14%, which comes about...
In Ghana, it's high?
14%, relatively higher than the global rate.
How is that possible?
I mean, there are quite a number of factors that contribute to this.
Wow.
Yes. So in Ghana, it's quite common. So you'd have maybe 1 in 7 or 1 in 8 babies being premature.
Okay. So I would want our nurse to help us here understand what are some of the risk factors or some of the things that you do that could possibly make you have or carry a preterm baby.
Okay, one is infection.
Infection.
Yeah, socio-economic growth also talks about it. Alcoholism, smoking.
Please take your time. Let's take it one after the other. Okay, so let's get started again. Alcoholism.
Infection, smoking. Some of the disease to come. Let the baby come out like HIV, syphilis, which are exposed, hepatitis B babies too. They also come out early like that.
Okay. When you say infection, can you please elaborate on that?
Okay, infection like maybe gonorrhea or candidiasis. It can also predispose the baby to also come out like that.
Okay, I see. So even when pregnant, you are exposed to
infections like that. It can also let the baby come out.
You mentioned alcoholism. So let's say in a situation where maybe you were doing a lot of alcohol before you got pregnant, but then during pregnancy you are being advised to stop taking alcohol, and so you do stop. Could that in any way still affect you?
Yes, it can affect.
Although you stop taking the alcohol?
Please.
Oh, then that's not good.
And some drugs too can also let the pregnancy also come.
Some drugs?
Yes, please.
Okay. So it's all dependent on the mother?
Yes.
What the body can contain, is that it?
Yes, that's it.
Oh. Okay, so are there any more risk factors, Belinda, that you would want to?
So, I mean, Jenna, let me just regroup it so that it's easier for us to follow. So the causes of prematurity is multifactorial. You can't pinpoint it to one cause of prematurity.
Okay.
So we have the maternal causes like she was talking about.
Speak up for me.
We have the maternal causes like she was talking about. So maternal infections like the urinary tract infections.
Yeah.
And other infections. And then we have maternal medical conditions. So commonly hypertension. So hypertension in the mother, diabetes, sickle cell, asthma, all these things predispose the mother to having preterm delivery or preterm labor, and also that's premature rupture of membranes. Even trauma could also predispose the mother to having a preterm delivery. And then there are also the fetal causes, whereby the baby in utero is in distress or is having some difficulty breathing. The baby would want to come out, and
Okay.
And also when the baby is also small for their gestational or very small babies too, there's a tendency they may want to come out. And also some placental causes. You know, the placenta supplies nutrients and blood to the baby. So if there are problems with the placenta, maybe the placenta is very low lying, you can also have preterm delivery, or maybe the placenta more or less abrupts or breaks from the site it's supposed to be. All these things can cause preterm. Sometimes it's not just one of these, but just a number of these can come together and then cause preterm delivery.
Ruth, I want to know how were you told about having a preterm baby? How many weeks were you?
I was 28.
28 weeks.
Yes. And it was due to health situation.
Can you please speak up for me?
It was due to health situation, and I became a preterm mother.
Oh. Do you mind sharing what health situation it was?
In my situation, I had a problem with my UTI. I had UTI.
Oh, okay.
I often have UTI.
Okay.
So I was always
Which
in
is a
pain.
urinary tract infection.
Yes. Okay. So I was always in pain.
Oh.
So my baby couldn't contain it anymore.
So he came out at week 28?
Yes.
Wow. So take us through how it was for you.
It was actually painful.
It was painful?
Yes. During that time, during my childbirth, it was painful. And thank God it came. It was very little. My baby was very, very, very little.
How much did it weigh?
I think 1.
You don't say.
Yes.
2
One.
sachet.
Yeah.
1 kg.
Like
A meat.
1 kg rice. Yeah.
Yeah.
1 kg.
Yeah.
How did you feel when you saw him?
Frightened.
You were frightened. And what was running through your mind?
God help me.
So right now, I want to understand some of the things. What did you have to do? What were the doctors telling you to do? Because he's that little. What did they do? Put him in an incubator?
Yeah.
I want that whole process.
Yeah.
What were some of the things that you as a mother had to do?
You have to dedicate all your time.
Okay.
And then you have to go and see your baby every 3 or 2 hours in the incubator. You have to somehow find a way to communicate with your baby.
Oh, you have to? Really?
Yes. Whether he can hear you or not. It also gives them some kind of motivation for them to live, and for you, the mother, as well. So you have to always be on time to be there to feed your baby and then have this kind of bonding.
So you have to be talking with the baby,
Yes.
possible singing to him or her.
Yes.
Right. And you were doing all that.
Yes. And as a mother, you have to encourage yourself because it's not that easy.
Yeah.
Yeah.
Yeah. Okay, Belinda, take us through the stage of after a mother has been told of you're going to have a preterm baby, the baby comes out, and then what next? What do you do?
Okay, thank you. So even sometimes the mother may not even know that they are going to have a preterm baby. So sometimes you may not have adequate time to even prepare the mother because most of the time there are emergencies that come.
Right.
So I mean, once the baby comes, once baby is breathing, irrespective of your gestational age, some are as low as 26, 25 weeks. I mean, we accept you into the NICU, and so we start IV fluids. I mean, one of the main problems of prematurity is heat control. So I put you under a radiant home so to assist you with your heat control, and then later put you in an incubator, give you IV fluids to support you for the first day of life. Depending on the problems you may come with, some actually come with problems like respiratory distress. Based on how they present to us, we give supportive care. So we have machines like CPAP that help with those with respiratory distress. We cover them on antibiotics if it's indicated. And these are at least the initial things that we do. Once baby is ready to feed, feeding is initiated later on, and then supportive care.
I wonder right after birth, because usually after a woman gives birth, immediately the baby is taken, the baby starts sucking on the mother's breast to feed. So for a preterm baby, how does that work?
Okay, so our preterm babies, I mean, most of them are pretty small, unless it's a late preterm. Those ones are a bit bigger, and so those ones we can put to breast.
Okay.
But the very small ones, I mean, the sucking reflex has not even developed. Coordinating between suck and then swallowing is not there. So for those ones, breastfeeding cannot be initiated like a term baby.
So how do they feed?
We support them with IV fluids, and constantly, I mean, we can start feeding via the orogastric tube or nasogastric tube.
As in you insert?
We insert a tube through their nose or through their mouth into their gut.
Okay, like on the screen.
Yes, like this here. And so we feed through the tube, and their feed is usually breast milk, and so we feed via the tube until the suck reflex has been developed, and then we change from the OG tube to possibly a cup and spoon until later. If baby is able to suck and then swallow at the same time, then we can graduate to put into breast. Yeah.
Oh, okay. So
it's more like a stage by stage, depending on how the baby presents to us, and then how ready the baby is for that particular stage. That would influence the mode of feeding. Okay,
so the baby is put in the incubator. How long, a lot of the time, so approximately, how long can a preterm baby stay in the incubator for?
So the number of days is not fixed. It depends on the baby and how well the baby is gaining weight. So usually we will take you out of an incubator. If you're about 1.2, 1.3 and you are stable, that's where kangaroo mother care comes in, where the mother now serves as an incubator for the baby. And so the mother is more or less like providing heat to the baby. Okay. Yeah, so once you are not on antibiotics, you are off oxygen, you are off IV fluids, maybe you are just feeding and then we are supporting you with your micronutrients. We initiate kangaroo mother care. It has quite a number of advantages, and so we encourage it because the baby is usually tired. Our nurse would demonstrate how it's done.
I want you, can you please help us with that? Okay, so that is the skin to skin,
yeah, right. On the chest.
On the chest.
The mother, once the baby is here, the baby is getting heat from the mother, and it encourages bonding. I mean, with the baby, because if the baby is in an incubator, the mother doesn't have the opportunity to carry the baby. But once the baby is on your chest, I mean, oh, okay, me too, I have a baby. I mean, so there's some bonding that is encouraged. If the baby is on your chest, you are also encouraged to.
Can you come closer?
Breastfeed. So these are some of the.
Okay.
These are some of the benefits of the kangaroo mother care.
Right.
And it also helps with breathing. It assists with the breathing of the preterm.
So this is way after the baby is okay, you know, feeding on his or her own, breathing on his or her own, and then all that. Okay. Then you start encouraging the kangaroo mother care.
Yeah.
Okay, so there's a special cloth for it.
Yes, there's a special cloth to make it easy. Okay. And it's not only the mother. If the father is available, the father can also do the kangaroo. I mean, sometimes some babies, maybe the mother is very ill. We, the staff, we also do the kangaroo mother care for the babies. Yeah.
Wow, that's so sweet. Okay, so this is how it's done.
Yeah.
So how long would you do this for?
So we do this until baby has attained at least a weight of 2 kg.
Ruth, did you have to do this?
Yes, I did it.
So 1 kg.
Yes.
You have to stay in the incubator for a while.
Yes.
So at what stage did you have to start doing kangaroo mother care?
I think after 2.
After 2 kg.
Yeah.
That's when you started. But then
no. I started my kangaroo mother care right after the incubator.
Oh, right after?
Yes. So I continued till my baby was like 2.5.
Okay, so in the incubator, how long did he stay in there?
Can I remember? I think a month or half or something.
Okay. And did you have to be sleeping in the hospital?
Yes.
You were sleeping there?
Yes.
So you were literally admitted?
Yes, because during the night, you have to go back to Nico and go and take care of your baby.
What are some of the things that a preterm mother have to do
for
in
the
taking
baby?
care? Yes, for the baby.
You have to do kangaroo mother care.
Yes.
That one.
Yeah.
It serves as a bonding for the mother and baby.
Yeah.
It's also helping heat regulation for the baby.
Yeah.
And it's also helping good growth weight. It also prevents infection. And it's also help you to hear the heartbeat of the baby as you do. Yes.
Oh, it's for you to feel the heartbeat of your baby.
Yes, skin to skin.
Yes.
It also help the baby to become fat.
Yeah, to gain weight. Yes.
And the feeding also help.
Right.
It also prevent the baby from aspiration. If something is happening to the baby, you can see it earlier, and you draw the nurse attention.
Wow. Okay. Oh, this is very interesting. Okay, so tomorrow is World Prematurity Day. How is this being celebrated here in Ghana?
Okay, it's celebrated globally.
Yes.
And in Ghana, we are not exempted from this. So, I mean, in every hospital with a pediatric department, definitely they will have a little celebration, a little sensitization in the hospital, just to educate the general public and also to create awareness about prematurity. So Interma General is no exception. We are also having our celebration, God willing, tomorrow. So if you are in and around Tema, you can pass by the pediatric department and then join. I mean, you learn a thing or two about prematurity. So that's how we are celebrating it tomorrow. Yeah. And I just want to add, prematurity is not a disease. I mean, some mothers, once they have like preterm babies, they start blaming this as if they are responsible. Some think it's a curse, and I mean all sorts of things. But really, sometimes a mother can do everything right, but baby will still come out preterm. But I mean, now with technological advancements, and then a specialist care, we're able to care for these babies. So that's a 28-weeker, I mean, very small. But you can see the child here, and the child has survived. And also having preterm, being preterm or having a preterm baby is not the end of the world. There's support available, there's help available for you.
Belinda, thank you very much. Ruth, I want you to tell any mother out there who's, who has a preterm baby, what would be the advice that you would give to them?
Okay. Mine is to say, stick to the rules the doctors give you. Trust me, it will work out.
Okay. All right, Ruth. Ruth says that stick to the rules that the doctors give you and trust that it will definitely work out. I mean, you saw earlier, her beautiful baby boy. I mean, for him to have come out 1 kg and looking at how beautiful he's grown and looking all big and everything, it's impressive. And so, Belinda, thank you so much for being here. Belinda Mavey, so my guest today, Dr. Belinda Udai, but medical officer, neonatal intensive care unit, Tema General Hospital, and Mavis Nyamadi, who is a nurse. She was the one who helped us demonstrate the kangaroo mother care. And then Ruth Soa, mother who had a preterm baby. Ladies, thank you so much for being here. Have a lovely morning, and tomorrow we'll do our very best to come and celebrate with you.
Okay. A few final comments.
Yeah, sure.
So I'd like to, appreciate the leadership and management of the Tema General Hospital for this opportunity.
Okay.
And to my head of department, Dr. Frimpong Befi, thank you so much. And to all the specialists, colleague doctors, nurses, and everyone in the Tema General Hospital neonatal intensive care unit. And a special one to my husband, he came to drop us here this morning, and so we are very grateful. And thank you so much for the opportunity to be. I'm grateful.
Yeah. Thank you too for being here. Thank you for letting us be aware of all of this. So like I said, tomorrow we'll definitely celebrate with you at the Tema General Hospital. Viewers, this is where we end this conversation.